Many of us in the BHA are clinicians, many of us are policymakers, policy advisors, but we never want to lose sight that we are doing work that is impacting real lives. And so we welcome folks to constantly remind us that this is talking about real people with real names that are being impacted by the work that we are doing.
Yeah, you know, it's important for us to highlight our current commissioner, Danette Smith, has only been here 14 months. And to see the evolution of the Behavioral Health Administration just in these 14 months, it was, we described this today as a bit of our coming out party.
Today's event, we use the word inaugural, right? The expectation is we're going to keep doing this because we, as government, right, of the people, by the people, for the people, need to be held to account. All right, here are the things we say we're trying to build out for this system to serve all Coloradans. We're going to do a checkpoint on an annual basis and recalibrate, right? Mistakes are going to be made. There's going to be hiccups. There's going to be unexpected financial turbulence that's out there, and we're going to persevere, and we're going to do that check-in with our community.
I think that one of the ways that the BHA is going about doing it, which is a little unique from a lot of states, is that we are launching our BHASOs, Behavioral Health Administrative Service Organizations. It is a one-door, front door access to receive behavioral health services. Folks don't have to go throughout the state trying to figure out and navigate the process on their own. It's a streamlined system that will help people get the services they need, no matter what their insurance level is.
I think one important part of the implementation approach is actually using the data that we've been collecting for decades to inform our program evaluation and program planning.
What the research has shown us is that the need for behavioral health services only increased during the COVID pandemic, and we don't see that really plateauing right now at this particular point. So I would say over the next 5 years, we, as stigma is stripped from the idea of receiving behavioral health services, not only will we see the need continue, but we will see people's willingness to access services and seek them out.
First, we normalize talking about it, right? If someone has a physical injury, if someone has an illness like cancer, people aren't suffering in silence. But unfortunately for behavioral health, that's too often the case. And certainly having a robust, healthy 988 contact center, that's great that people can call at any time. But breaking down that stigma is for people to be able to talk about it. And that's one of the things we've really highlighted is we want to hear from the voices of lived experience. I think for too long, we've listened to some people with expertise, usually the people with the letters after their name, that have gotten the higher education, and that's important. The providers of service, that's really important. But we have to hear from the people that are living every day and that are living in recovery from mental health, substance use, to inform and make this system better.
Come July 1, you've heard us talk a little bit about July 1. It's a huge, huge day for us in the Behavioral Health Administration, or the BHA. We will be rolling out Colorado Lives, and Lives stands for Linking Individuals and Families to Services. We will be rolling out our website. It will be connecting Coloradans to behavioral health care. Again, doesn't matter if you are insured, uninsured, underinsured. You can go to this website, find exactly where you will receive services, get connected to a myriad of things.
I want to talk a bit about how the work that we've been doing over the past 3 years is really going to be activated with this launch. So if you're familiar with this team, you know we've been actively and rapidly building public and provider-facing technology to streamline care coordination, care navigation, and reduce administrative burden. A lot of that impact hasn't really been seen yet, though. We're really excited to activate, iterate, and build upon that with this launch. In addition, a lot of the work that we're doing with technology is improving data collection systems. So what we've understood with the data available is that unsurprisingly, it is youth that we expect to be the highest in terms of need for these services, so particularly for mental health, minors under the age of 19, and young adults aged 19 to 44. For substance use disorder, we expect similarly younger adults aged 19 to 44 requiring those services the most. And finally, I'll mention our Colorado 988 program. There we're expecting about 250,000 contacts for the remainder of 2025. And specifically looking at, we're expecting that the highest age group that's going to require that service is the age of young adults, ages 26 to 39, specifically looking for support with interpersonal and social stress, well-being, and suicide factors.
Youth are really at the core of care needs, so we need to make sure that we're focused on listening to youth, and understanding more than what the data tells us. The data can only tell us so much. It can tell us that the need is there. It can tell us where the need is. But what kind of need and what kind of support we can offer is really where we need to take a step further and engage with youth.
Here's the challenge: money, right? We don't have new money. And if you read the news, there's a concern that the entire system in the future could have less money. Nonetheless, this system by itself will make an impact. But let's talk about where our money comes from, our state agency money. We have about $11.5 million in federal mental health dollars from our block grant. We have a mental health block grant. We have about $14.5 million in federal discretionary funds that we manage. We have about $21.2 million in our federal substance use disorder dollars. Again, that's largely our block grant for substance use prevention, treatment, and recovery. And then our state funding. And again, there's lots of different colors of state funding. It's all blue here. You've got cash fund, you've got general fund, we got reappropriated fund from judicial, whatever. We have lots of pieces, lots of different colors, but state money is the biggest portion of our dollars, and all combined, over $200 million that we're able to flow through these behavioral health administrative service organizations to build those networks, provide some financial support for the people who can't afford it and don't have insurance. We're gonna pursue this with hope and power through with the resources we have. If there's one message I always like to remind people, no matter what people might be going through at any given moment, is that, you know, people recover. People with mental health, people with substance use, they recover. Life can and will get better. Reach out for the help. It'll be there for you.